You had an ultrasound. The doctor says you have a fatty liver. You ask, is it serious? Months later, sometimes years later, your knees begin to ache. You think these are two completely different problems. Nobody tells you they may be connected. Coincidence? Maybe not. Most people think a fatty liver stays inside the liver. It doesn't. Doctors now call this condition MASLD. But for simplicity, I'll just call it fatty liver.
A healthy liver is smooth and rich red in color. Fatty liver disease causes it to enlarge, turning a yellowish hue as fat accumulates.
Your liver is one of the largest chemical factories in your body. And when it changes, the whole body hears about it. Think of a fatty liver as a warning light on your body's dashboard. It isn't simply telling you something about your liver. It may be telling you something about your whole body. Here is what matters. A fatty liver is not just a liver problem. It is a window. It tells you the body is carrying a quite low-grade inflammation, the kind you cannot feel. And that inflammation does not stay in one place. It changes the biological climate inside your body. What does this have to do with your knee? The knee is not being attacked by the liver. The liver isn't attacking the knee. Your liver isn't causing your arthritis directly. Your knee isn't making your liver fatty. They are both responding to the same metabolic environment inside your body. The liver and the fat around your abdominal organs are constantly talking to the rest of your body through the bloodstream. The knee is living in that same bloodstream. The same metabolic state that put fat into the liver is also at work inside the joint.
Visceral fat is actively inflammatory. It releases cytokines into the blood. This directly breaks down joint cartilage.
The lining becomes more inflamed. The balance inside the joint shifts from repair towards breakdown. The bone beneath the cartilage becomes biologically more active too, sending out its own inflammatory signals. One route, two places. Here is a way to picture it. Imagine your bloodstream as the air conditioning system in a building. Every room breathes the same air. If that air becomes polluted, the liver, the knee, the heart, the blood vessels are all exposed to the same environment. They may not all become sick at the same time, but they are all living in the same air. Studies now suggest that people with fatty liver have a modestly higher risk of developing knee osteoarthritis, particularly when excess visceral fat is also present.
Visceral fat is actively inflammatory. It releases cytokines into the blood. This directly breaks down joint cartilage.
Modestly, not certainly, but enough to take seriously. ஒரே வேர் இரண்டு இடம். One root, two places.
ஒரே வேர் இரண்டு இடம்.
But my sugar is normal. Here is the part that surprises many people. You can have normal blood sugar and normal HbA1c and still carry this inflammation. In the research, the link to the knee did not require diabetes. It tracked the metabolic load, the visceral fat, the fatty liver, not simply the sugar number. Blood sugar is only one marker of metabolic health. It doesn't tell you the whole story. So don't let a normal HbA1c make you think everything is fine. This is why doctors no longer think of fatty liver as only a liver disease. It affects the heart, the blood vessels, the kidneys, and increasingly research suggests the joints. Your body works as one connected system. Your organs constantly communicate with each other. Your knee is simply responding to the environment it lives in. Treating the terrain is not only about the liver, it is about improving the biological climate throughout your body. Reduce visceral fat slowly, steadily. Build muscle through resistance training. Choose a Mediterranean style pattern of eating. Reduce sugar, sweetened drinks.
Sometimes, the best choice is also the simplest one.
Reduce ultra processed food. Sleep well. Keep your blood pressure and cholesterol under control. And most importantly, keep moving. Every one of these changes improves your overall metabolic health. They are proven to benefit your liver, and they may also help create a healthier environment for your knees. If you're overweight, if you have a fatty liver, and your knees hurt, don't file them as three separate problems. They may be one story told in three different places: one body, one biology, many organs responding to the same environment. Three warning signs: fatty liver, excess body weight, knee arthritis. At the Madras Joint Rejuvenation Centre, we don't stop at the x ray. We look at the biological environment driving the arthritis, including inflammation, metabolism, bone health, and the condition of the joint tissues. Because treating the whole patient means looking beyond the knee. If you have been told you have a fatty liver and you are beginning to experience knee pain, don't ignore either of them. Ask why they may be occurring together. Because sometimes the first step in protecting your knees is improving the health of your whole body. I am Dr. A.K. Vegrachal. Thank you for watching.